jemma la cho timo darbano tim ki watete gi genma mio kuro berti kendano wa wachigi lok madare kom kan lok madare kom chato chamme ar enoni jemma kelo kuro I ar kenda cho kidaro.
The successes of this project have largely relied on addressing the psychosocial aspects of mainly the women and young girls.
What we are proud of is seeing more women now engaging in group activities, being able to work together. We are yet to measure their self-worth, their attitudes towards themselves. Are they able to come out and be able to contribute to their well-being, you know, positively or confidently? We are yet to measure that because this takes quite some time. But of course we have interventions that are geared towards that. We are happy that apparently they freely involve in group activities. They are able to join VSLA groups. So far, that is the achievement we can pause of, and also being able to seek support when they need support, which was not the case in the past.
Right now we are having a community dialogue. They are discussing the effect of sexual gender-based violence and the effects on their family and the community at large.
The issue which we have tried to handle in our community is domestic violence between a woman and a man in their family. So we tried that one in the position where we could help and stop it. When they have not yet gone further, we stop it.
These community dialogues also provide a platform for addressing many other social challenges like gender-based violence in homes. CARE and its partners are now using these spaces to communicate in more creative ways about addressing challenges like alcoholism and gender-based violence.
Initially, when we had just come to Lamoge sub-county, there was high rate of domestic violence amongst the people of Lamoge, and this was basically caused by a high level of alcoholism, whereby most of the household heads used to engage in drinking alcohol. So when we came in, we started using drama to sensitize the people on the dangers of domestic violence, and through using dramas, we have tried to reduce the rate of domestic violence because by acting, the community gets to know the advantages and disadvantages of domestic violence at home. And it has really helped ALPI, together with CARE, to curb down the rate of domestic violence at home.
By the time we started working around issues of gender-based violence and gender in Northern Uganda as early as 2005, it was very common, you know, evening to hear women crying out for support and maybe running away, having these divorces and the like. But I think there's a big difference. It's anecdotal, but at least people can say that there is a change. There's less fighting within the communities. And also I think today, when you talk to women in the communities, they will tell you that they know where they can be able to find support if an issue happened, or if they fought, or if they had a case of domestic violence or an abuse.
What happens is that because of the good political will and because of the existing civil society, they've gone ahead to supplement on the work of government to help at least the people at the grassroots to understand, to appreciate, and to call on the key duty bearers to actually implement, to do what they're supposed to do. And at the moment, I'm happy to note that actually there's been a lot of progress on that. There's reviewing of the police Form 3, that's what it's called, to make sure that there are other medical people, there are other health workers that can act, that are on the ground, that can examine the survivor on spot and give a report so that the person can actually have the required treatment prior.